My presentation is over cancer as a chronic disease. So, intro into cancer. Cancer is characterized as a disease that's caused by the overall uncontrolled rate or pattern of the cell. So, the cell is overall growing too rapidly to control. It can be linked genetically or caused through environmental factors such as chemicals, smoke, things like that. Majority of the cancers affect those over the age of 55 and is more in men than women, and is the leading cause of death in the United States. So the role as the nurse in cancer is obviously educating your patient of those risk factors, so letting them know what they're personally at risk for. So whether that be smoking, if they're a smoker, set a plan to decrease how they can stop smoking. Whether they smoke a pack a day, get it down to a half a pack a day. Or if they work in a factory that exposes them to chemicals, maybe have them wear a mask. So just kind of set a plan to decrease those risk factors, or let them know what risk factors they may be exposed to, because they may not know some of those risk factors. Screening for cancer is a big one, like breast cancer. Women need to start screening for breast cancer if they are genetics, the BRCA gene. For ovarian and breast cancer, they need to know if they need to be screened for that, if they have a history, anything like that. If patients have cancer, make sure they're complying with their treatment regimen and they're following up with their healthcare providers, and they're not missing any treatments or missing any appointments if they need help getting those appointments. Connecting them to those resources that can help them get to those appointments. Or telemedicine is becoming a big one, getting those access to those things. And just providing those correct resources for the patient and the family, because this can play a big role in the family, like support groups, respite care, things like that. Some other nursing roles is providing relief and support after the treatments, because after those treatments, those patients don't feel good. They're going to be sluggish, they're going to be fatigued, they're going to be ill. So just making sure you let them know how they're going to be feeling after those treatments, and letting them know that they need to rest and they stay up on their medications and stuff, and letting their family know how they may act and how they may feel afterwards. Also, it's really important to assess the patient and the family's understanding of the process and how they can intake that. So making sure we're not using a bunch of medical jargon and anything like that, because we want the patient to be able to understand to the best of their ability and not talk over them and let them process all of it, because it's a big thing. So making sure they ask questions, we allow for silence, allow for time for them to ask questions and talk to the physician, or we can be like, okay, would you like us to bring that to the physician, and things like that. Administering proper medications to minimize side effects. So these patients are going to be quite nauseous with their treatments for chemo. So maybe administering an antiemetic like Zofran, it's a big one. Just managing those side effects, letting them know that, hey, this treatment can make you quite nauseous, so we're going to administer this beforehand to try and manage that. Just letting them know those things is a big thing. Also, a big one is the effects on the reproductive system. Pretty much all cancer treatments, radiation, chemo, surgery, even surgeries can have a big effect on the reproductive system. No matter what the patient's age is, that needs to be a discussion. So talking to the doctor and being like, hey, this patient's older, but we still need to have this talk with them. It's just really important, like setting aside eggs or sperm in banking, letting them know that this can affect their sex life, things like that. It's just really important to have that talk no matter what the patient's age is. Proper hygiene. rinsing their mouth out. They can get those sores in their mouth. They really need to clean out their mouth, brush their teeth, wash their hands. That's a big one. Wash their hands properly with soap and water. Carry hand sanitizer with them. Wear masks if they're out in public. They're really at risk for infection. Their immune system's down. Avoid large crowds if they can, but still make sure their life is as normal as possible. So going to church, going to like family parties and stuff, but they just need to be careful to avoid sick people and anything like that. So they are immunocompromised. Just they need to be aware of that. Their family needs to be aware of that. So there are a lot of risk factors associated with cancer. Some non-modifiable ones are age. So obviously I said older people are more at risk. So the older you get, there's more risks for like colon cancer, rectal cancer, for men, prostate cancer, things like that. Genetics and family history, the BRCA gene, it's a big one. That's where the screening comes in. If you know you have a family history of breast cancer, some insurances cover getting tested for that BRCA gene. So go and talk to your physician, see if that can be covered. Personal history, if you have a history of cancer yourself, you're more at risk for developing cancer later on again, or even other types of cancer. Chronic illnesses weaken immune systems. If you already have a chronic illness, or if you're immunocompromised yourself, such as Hep B, HIV, the Epstein-Barr virus, things like that, you are at risk for, and some of those are modifiable, like you may have developed those from activities that were being done by choice, but it's not modifiable anymore, so therefore it's non-modifiable. Those are things that put you more at risk. Some ethnicities are at greater risk for developing certain kinds of cancers, such as a Hispanic, American Indian, Alaskan Native woman are more at risk for developing cervical cancer. Some modifiable risk factors are your activity level. So if you're having a sedentary lifestyle, puts you more at risk for developing certain kinds of cancer. Your lifestyle choices, so alcohol abuse, tobacco use, things like that, what you eat, can put you at risk. Use of sunscreen, obviously skin cancer, it's a big one, especially with those who are lighter skinned, who are very like light and complex. They need to wear sunscreen, especially, or avoid those really heightened hours of sun exposure. And exposure to chemicals, that could be either modifiable and non-modifiable, because some people don't know they're exposed to certain chemicals, but there are some chemicals that people willingly expose themselves to. So these are the treatment goals for cancer. Curative, that is where the disease can be like destroyed, the cells can be destroyed. It is obviously dependent on the cancer type. The most often way this is cured is through surgery or radiation. Also, combo therapies are used like after, within the treatment or afterwards as well. Like if there's basal cell carcinoma is a good one that they use. This is curative, where after they have the surgery to remove the skin cell, they use radiation to that specific point. Oftentimes, though, there may be a likelihood that it may reoccur later on down the line. So for control, the goal is to slow the progression of the disease. So this is often used with combo therapy, such as radiation and chemo, or they'll have surgery and they'll continue chemo on afterwards. Or they go through an initial treatment that is like very intense, and then they follow long-term maintenance treatment for several weeks or even years. Palliative is where it's not curable, but they control the symptoms and they maintain the patient's comfort. And what I thought was like the biggest part to this palliative is they're not treating the disease itself, they're treating the patient's symptoms because they want to keep this patient comfortable and make sure this patient is living to like the best quality of life that they can. So some complications of cancer treatment. Obviously fatigue is a big one, and it affects the patient's quality of like daily living. Like they're not able to complete their day-to-day activities. They're extremely fatigued, tired, not able to get out of bed some days. They just are really, really tired. This is the symptom that patients often complain about the most, because it just really does impact their day-to-day life. Another complication of cancer treatment and cancer in general is GI and GU symptoms. Patients can oftentimes experience nausea and vomiting, heartburn, mucositis, anorexia, diarrhea, all kinds of symptoms, and it's very uncomfortable for them. Makes it hard for them to get out again. Impacts their day-to-day lives because when they get out, they're like, am I going to have to find a restroom right away? With their GU, some may have urgency, some may have hesitancy, some may have difficulties just like with stream or just trouble holding it in and may have incontinence of some kind. So that again impacts their day-to-day lives. Also, just the nausea and vomiting is another big one that patients are often struggling with day in and day out, which really impacts their nutrition, which nutrition is a big thing for cancer patients because they struggle with their nutrition and they often become very malnourished. So it is big to kind of watch their diets. And to control their nausea and vomiting, it's very important to pick a medication, like an antiemetic, that really works for them. Neutropenia is more common in patients who receive chemo, and it is very life-threatening. It's a risk factor for sepsis, and it needs to be taken care of immediately. Anemia is also very common for chemo and radiation patients. This needs to be monitored. Some patients need iron supplements. Some even need packed red blood cell transfusions. Just monitor their hemoglobin levels. Their skin changes. Some may have rashes. Some red skin, bruising easily, things like that. Just make sure to let them know if they're outside sunscreen. Avoid those high hours of sun exposure, especially those who are on radiation. Their skin may become raw and very uncomfortable to the touch. Hair loss is a big thing. It causes emotional distress. Like, let them know there are groups that will help them cope with that, and like there are some supports that make bandanas and things like that. That goes along with the cognitive and emotional. There's going to be a lot of emotional change in. Their moods are going to change. They're going to become irritated more easily. Frustrated, angry. Let their families know that these are common, that they just need a little extra support, may need a little extra time coping with these things. They are immunocompromised. Just kind of be aware of that. The cardiovascular and pulmonary effects. Be aware that there could be, if they have difficulty breathing, they're short of air, they need to let their physician know. And with the reproductive system, just let them know, discuss their options. Again, with all patients, doesn't matter their age, just discuss that. These are all support groups for those who have survived cancer, but also options for those who are currently going through cancer treatments. These are great resources to give patients and their families. Just has all kinds of information on it. And these are my references. Thank you.